The fertility evaluation for men is pretty short and sweet with the semen analysis, but women are more complicated and we have more roles to play in the reproductive process. So with the evaluation, we need to look at the uterus in terms of functioning tubes, a good cavity to hold the baby, and then also look at the ovaries, which are the repository for the eggs that'll make the baby. So the evaluation involves a hormonal evaluation where I can look at how the brain and the ovaries are talking to each other, and then I can get an idea of how many eggs are left in the ovaries for that woman for her age and tell her if she's got a good amount of eggs, a lower amount of eggs, or average number of eggs for her age. And then I can do an ultrasound where I look at the ovaries themselves and see follicles. They're called antral follicles, which are sacs of fluid that contain eggs. And I can do an antral follicle count and right then and there tell that woman if she's got a good number of eggs based on ultrasound evaluation. And then also look at the uterus, the shape and contour, make sure there's no fibroids, which are smooth muscle tumors that can kind of get in the way of things for reproduction. And I can do a hysterosalpingogram. That's another important part of the evaluation, which is kind of like an x-ray, but it's a live x-ray where I put dye into the uterus and actually watch it spill through the fallopian tubes. And this lets me know that the tubes are open. It also lets me see the shape and contour of the inner cavity of the uterus and make sure there's no polyps or fibroids in the cavity. And then one more thing that's helpful is to do a sonohystogram, which is an ultrasound where I put fluid in the cavity. And that one's very similar to the HSG in terms of it does do a cavity evaluation, but it doesn't tell me anything about the fallopian tubes. But the sonohystogram is superior to the HSG in that it is a high definition image of the cavity and really lets me see polyps if they're present, which are soft tissue masses in the uterus that could interfere with implantation of an embryo, or if really large could cause miscarriage. The other thing about the sonohystogram is it allows me to measure from the tip of the cervix to the top of the uterus. So in the case of someone doing in vitro fertilization where I plan to do an embryo transfer, I'll be able to know exactly the length of that cavity, so when I put an embryo in, I know the best place to put it.